Hi everyone, this is Dr. NG, still talking to us on infertility. Last time I spoke to us about what infertility is and what are the parameters or what are the conditions that must be fulfilled before we talk about infertility. Today I want us to be looking for causes of infertility in men. Like I made us understand in my last video, when there is a problem of infertility, one party should not be blamed. What the couple should do is to check themselves out, check the female, check the male, and then we find out where the cause and possible treatments can be given. Like I said before, some people think that when there's problem of infertility, when a couple can't have a child, then the woman should be blamed. The woman, who knows? The woman cannot have a child. It takes two to have a child. It takes two people to have a child. It's only when a man gets a woman pregnant that she can be pregnant to have a child. If the man is not able to impregnate a woman, then she can't be pregnant. As long as the natural laws are concerned, the man has to have sex with the woman and conception will be achieved. So it's never a one-party thing. It's never a one-party thing. So today, let's quickly look at causes of infertility in men. But before I look at that, let me make us to understand that this falls under the reproductive system, because I'm going to be looking primarily at the reproductive system now. There can be other causes from other systems, but let's primarily look at the reproductive system, which is the system that basically controls fertility. Okay, now let's get started. When there is infertility problem in a man, it can basically be as a result of problem with ejaculating the sperm, because the sperm has to leave the body of the man, get into the body of the woman, meet with the egg of the woman, fertilization will occur. That's fusion of the egg and the sperm will occur, and then the fused cell now will be implanted in the womb of the woman, the uterus, and then she can get pregnant. So if the man is not able to ejaculate, that is to release the sperm from his body into the woman's body, then she can't get pregnant. That is number one, ejaculation problem. Now that sperm is a cell. The sperm is a cell. The whole thing you pour out into the woman's body is not just the sperm. What you pour out into the woman's body is a semen. Inside the semen lies the sperm cells. I hope we are getting it. Inside that whole fluid you poured out that you call sperm, that is the semen actually. There are the cells, the sperm cells inside that semen. And it is these sperm cells I'm looking at. I'm not looking at the whole fluid that you poured out, no. Now, these sperm cells now, sometimes they can be abnormal cells. There is a normal shape, quantity of the sperm. When the sperm cell is low, remember, I'm not talking of the semen now. I'm not looking at the number of semen, the quantity of semen you poured out. I'm looking at the number of sperm cells in the semen. If they are few, that they cannot be able to perform this function of fertilization, the woman cannot get pregnant. Now I've looked at the sperm count. Now that's the quantity of sperm. I'm going to be looking at the shape, the morphology. The sperm cell has a head, it has body, and it has tail. You can't see these things with your naked eyes. That's why I'm trying to differentiate between the sperm and the semen. So it's not when you ejaculate tomorrow, you're going to start looking at what you ejaculated to look at the head and the body and the tail. You won't see it there. These things are viewed under the microscope. So some sperm cells have abnormal shape. Some of them may have two heads. They won't even have tail. Some of them may have just head, no body, no tail. They are abnormal. They cannot fertilize. They cannot perform the function. Now, before I round up this video, I want to make us understand that having sex every day, every minute, is not what is going to make you achieve conception. You know why? Because it takes the body of a man up to 48 hours to produce and mature sperm cells. So if you are busy pushing out, having sex every minute and pushing out sperm into the woman's body, you are going to be producing immature sperms that cannot perform the function. You understand? So when we say, like in my last video, I talked about regular sex interval. That defines about 3 to 5 times a week. 3 to 5 times in a week. 3 to 5 times, sorry, in a week. So ideally, if you are trying to achieve conception, you can have sex today, you leave the next day, you have sex the third day, you leave. Alternate day sex is actually better, so that you give the body enough time to produce and mature sperm cells that will do the work. I'll be continuing with this, and I don't like my videos being so long, because I notice that when videos are so long, people most times don't watch them. So in my next video, we'll still be talking about this infertility. I'll still be talking about infertility in men. There are some other points we need to look out about fertility in men. Look out for my next video, and make sure you follow and you share these videos. Thank you, and bye-bye.